Have you ever stopped to think if, you know, the way our hospitals run their energy use, their waste, if that affects more than just the planet? Like, does it impact our actual care or the financial side of things?
It's a really important question, and maybe not the first thing people think about,
Exactly.
but the connections are definitely there. And that's what we're getting into today, that intersection between, well, healthcare quality and sustainability. We're going to look at it using the ESG framework.
ESG,
Yeah.
environmental,
Yeah.
social, and governance.
Oh, that's the one.
And we've got some great material to draw on. Information from big players like Joint Commission International JCI and India's NABH, the National Accreditation Board for Hospitals and Healthcare Providers, plus ISQA, the International Society for Quality in Healthcare.
Yeah, and also insights from Supreme Medic Consultancy and just, the broader conversation happening around ESG and healthcare right now.
So our mission for this deep dive is what? To kind of pull these threads together?
Pretty much. Connect the dots, show how quality and sustainability with ESG guiding them are becoming, frankly, essential for the future of healthcare for everyone.
Oh, big, let's do it. So for anyone maybe not totally familiar, what is ESG exactly? And why is it such a big deal now for healthcare, which we usually just think of as, treating patients?
Right. So think of ESG as a lens, a way to look at how an organization impacts the world beyond just its profits.
Yeah.
The esophageal environmental, that's things like energy use, waste output, how a hospital manages resources.
Right.
Pretty straightforward.
Okay.
S is social. That's about people, staff, patients, the community. It covers equity, access to care, how people are treated, basically, inside and outside the hospital walls. Governance, that's the leadership structure. Transparency, accountability, ethical practices, how the whole thing is run.
Got it. ESG. And you mentioned healthcare is resource intensive. Just how intensive are we talking?
Oh, hugely. I mean, picture a big hospital running 24/7, the energy needed for lights, heating, cooling, all that high-tech medical gear. It's enormous. Then there's the waste, not just office paper, but medical waste, pharmaceutical stuff that needs really careful disposal. Plus water, supplies, the whole supply chain impact, it adds up fast, a really significant environmental footprint.
Yeah, when you put it like that. So why are healthcare organizations really starting to lean into ESG now? What's the push?
Well, there are some really compelling reasons. First off, efficiency saves money. Using less energy, fewer resources. That hits the bottom line directly, always appealing.
Sure.
Second, creating healthier environments helps people. Better air quality, less exposure to iffy chemicals that can genuinely improve patient recovery and make it a better place for staff to work. Their well-being matters too.
Definitely.
And third, reputation. Showing you're committed to social good, strong ethics. That builds trust, makes you an employer of choice. It's like one source, the QI playbook, said sustainability isn't just about being green. It's about being economically viable and socially responsible, too. Makes the whole system stronger.
Okay, let's dive into that environmental piece a bit more then. What are hospitals actually doing to be more sustainable? What does it look like day to day?
We're seeing a lot around energy efficiency. Simple things like switching all the lights to LEDs or upgrading the big HVAC systems, heating and cooling.
Makes sense.
But also bigger moves. Some are putting in solar panels or even designing new buildings right from the start to meet green standards like LED certification.
LED, that's the leadership in energy and environmental design.
Exactly. It's a big deal globally for sustainable buildings. And doing this stuff doesn't just cut emissions, which is crucial, but it also makes the hospital environment more comfortable for patients.
And what about all that waste you mentioned? That seems like a huge challenge.
It is. So waste reduction is a major focus, setting up really good recycling programs, finding ways to reuse items safely, making sure waste is properly sorted, especially the hazardous stuff, and critically, trying to cut down on single-use plastics. That's a big one. Plus, there's an environmental cost to doing too many tests or procedures. So thinking about overuse is part of it too.
Right. Avoiding unnecessary resource use in the first place.
Precisely.
Okay. And sustainable procurement. That sounds important. What's that about in a hospital?
It's basically making smarter, more responsible buying choices. So maybe choosing medical equipment that uses less energy.
Okay.
Or buying food that's, say, locally sourced or organic. Choosing bed linens or uniforms made from sustainable fabrics, things like that.
Ah, I see.
Every purchase has an impact, right? So thinking about the whole supply chain, where things come from, how they're made, helps reduce the overall environmental footprint. Choosing textiles made with less water, for instance. That matters.
And water use itself must be significant, too, with all the cleaning and hygiene needs.
Absolutely. Water conservation is key. So, installing low-flow faucets and toilets, maybe using collected rainwater for things like watering the grounds, making landscaping more water-wise.
The little things add up.
Yeah, they really do. It protects water resources and lowers the risk of shortages or contamination issues down the line.
And technology. I was thinking about telemedicine. Does that fit in here?
It definitely does. Telemedicine's growth is a big win for environmental sustainability. When patients can see their doctor remotely, they don't need to travel.
Right, fewer car journeys.
Exactly. Lower transport emissions.
Mm-hmm.
It's a clear link mentioned in a couple of our sources. Better care access and better for the planet.
Okay, let's shift gears a bit to the social side of ESG. Healthcare's mission is social, obviously. But how does ESG refine that focus? What does it add?
That's a great point. The core mission is there, but ESG pushes for more explicit focus on, well, equity. Ensuring everyone gets high-quality care, no matter their background, income, race, where they live.
So it's about fairness and access.
Yes, fundamentally. It's about breaking down those barriers, making sure the system works for the whole community, not just parts of it.
So things like making sure language services are available or that buildings are physically accessible. Outreach to communities that are often left behind.
Precisely. Those are classic examples of ESG-driven social initiatives. Using quality data to see if there are disparities between patient groups and then actively working to close those gaps.
And S isn't just outwards facing towards patients, is it? It's internal too.
Absolutely critical. The S is very much about the workforce, fostering diversity and inclusion, making sure staff feel valued, respected, have opportunities.
So I guess happy staff means better care?
Generally, yes.
Yep.
A supported, engaged workforce is essential. ESG metrics here might look at staff satisfaction, diversity numbers, injury rates, maybe even things like how many women are in leadership roles. It's about creating a fair and supportive workplace.
Makes sense. And community engagement, how does that fit?
Hospitals are often anchors in their communities, right? So ESG encourages them to look beyond just treating sickness. Things like running health education programs, promoting wellness, helping manage chronic diseases out in the community, proactive health support.
And looking after the healthcare workers themselves, especially after the last few years.
Hugely important. Employee health and well-being is a core part of social responsibility under ESG, providing good mental health support, wellness programs, ensuring a genuinely safe working environment. That's crucial. You need a healthy workforce to provide quality care.
Okay, that covers E and S. Let's talk governance, the G. How does this apply in healthcare, linking back to quality and sustainability?
Governance, in this context, is really about leadership making ESG a priority. It means the board, the executives, they need to own these goals, have champions, be accountable for actually meeting the targets.
So it starts at the top.
It has to. Strong governance provides the structure, the oversight to make sure things actually happen.
And transparency must be huge here, especially in healthcare. Trust is everything.
Absolutely is. Being open about how the organization is doing on its ESG goals is key. That often means publishing annual sustainability reports, making them public.
Yeah.
And it also means being transparent about clinical outcomes. That's part of good governance, too, showing your performance, being accountable for the quality of care itself.
And ethics. Seems like that would be central to healthcare governance.
Non-negotiable. Strong ethical principles have to guide every decision. Patient care and privacy always come first. That's fundamental. Sustainability efforts can't ever compromise patient safety or ethical standards.
Yeah.
That needs to be crystal clear.
And finally, just keeping up with the rules and managing risks. That's governance too.
Yep. Having solid systems to make sure you're following all the healthcare regulations, and also proactively spotting and managing potential risks, financial, operational, reputational. That's all part of responsible governance. Protects the organization, protects the patients.
This really does sound like a big shift in thinking. What role do organizations like JCI or NABH play in actually making this happen? Are they pushing this?
They play a really vital role, setting standards, providing frameworks, offering guidance. Take JCI, Joint Commission International. They're a huge global force in healthcare quality and patient safety. Been around over 20 years, accredited places in, over 70 countries?
Wow.
Their whole mission is about enabling the highest standards, so they set expectations.
Do they have specific things focused on sustainability now?
They do. Alongside their main accreditation, they now offer a specific healthcare sustainability certification, and one for telehealth, too. Plus, they have their standards, like the international patient safety goals everyone knows, lots of educational stuff. They're even holding a big meeting, Unify 2025, all about quality.
And what about more regional bodies like NABH in India?
Right. NABH is part of the Quality Council of India. They're crucial for setting those quality benchmarks within the Indian health sector, tailoring standards to the local context.
And ASQA, the International Society for Quality in Healthcare.
ISQA has been around for ages, over 30 years. They're global, not-for-profit, focused on spreading quality improvement knowledge worldwide. Education, sharing best practices, evaluation. Their next big conference, São Paulo 2025, is focusing on inclusive health systems. Ties right into the social part of ESG.
And there are also consultancies like Supremedic you mentioned that help hospitals on the ground.
Yeah, exactly. Organizations like that offer practical support, helping hospitals plan, design efficient facilities, recruit staff, set up quality management systems, even specifically guide them through getting accredited by someone like NABH. Hands-on help.
It's good to see this whole ecosystem supporting the shift. Can we make it even more concrete? Like, give an example of how an ESG goal translates directly into a quality improvement project in a hospital.
Sure. Let's say a hospital has an ESG goal to reduce its carbon footprint. Okay, so a quality improvement or QI project might focus on optimizing how they schedule operating rooms.
How does that help?
Well, you try to schedule them more efficiently to cut down on energy use when they'd otherwise be running but empty, especially during off-peak times. Direct energy saving, direct emissions reduction.
Ah, clever. Another one.
Okay, ESG goal, minimize medical waste. A QI project could then look really hard at single-use devices. Are they all truly necessary? Can some things be safely sterilized and reused with better protocols? Reduces waste and potentially cost.
Right. And for social or governance.
Okay, social equity goal. A QI initiative could be tracking readmission rates or patient satisfaction, but breaking that data down by race or income or language.
To spot differences.
Exactly. Spot disparities, then figure out why they exist and how to fix them. For governance, maybe an ESG goal of more accountability. A QI practice could be making sure that quality and sustainability metrics are discussed at every single leadership meeting, not just an afterthought.
Keeping it front and center.
Makes it part of the routine business.
And what metrics would a hospital actually track to see if they're succeeding with ESG integration?
We're seeing specific ESG-aligned metrics pop up. For EA, things like energy use per patient bed or the percentage of power coming from renewables. How much waste is diverted from landfill?
Okay.
For ES, maybe readmission rates looked at by different populations, like we just discussed. Staff turnover rates are a big one, too.
And yeah.
Compliance scores from audits internal or external. And maybe tracking the number of QI projects focused on ESG goals that actually get completed. Measurable progress.
It's useful to hear about leaders in this space. Any specific hospitals or systems doing this really well?
Yeah, there are some great examples. Kaiser Permanente in the U.S. is often mentioned. They've made huge strides on carbon neutrality and are known for quality leadership.
Okay.
The NHS in the UK, the National Health Service, they've explicitly linked their big climate goals directly to improving patient care quality in a major plan.
Really connecting the two.
Definitely. And Apollo hospitals in India are another example, really pushing digital health access and greener hospital designs as part of their ESG strategy. It shows it can be done, and done well.
So pulling it all together, it sounds like integrating ESG isn't just a nice to have, but offers real, tangible benefits. Can you quickly recap the main advantages?
Absolutely. First, better patient outcomes, especially through that focus on equity and addressing the social factors that influence health. Second, enhanced reputation and trust showing commitment really resonates with people.
Mm-hmm.
Third, real cost savings, optimizing resources, cutting waste. That saves money. And finally, it just makes the whole healthcare system more sustainable and resilient for the long haul, being prepared for future challenges.
So as we wrap up this deep dive, what's the main message, the big takeaway about ESG and quality in healthcare?
I think the key thing is they're not separate tracks. ESG and quality are like two sides of the same coin. They're interconnected. They reinforce each other. If you want a truly future-ready healthcare system, it has to be safe, effective, high quality, yes. But it also has to be sustainable, equitable, ethical, and resilient. You need both integrated together.
That's a really clear way to put it. Okay, one last thing then. A final thought for listeners to chew on.
Maybe just this. Think about how weaving these ESG principles into healthcare could improve your health outcomes, your community's well-being, but also how it contributes to building a stronger, more responsible healthcare system globally for everyone for the long term. And hey, if you're curious, check out the websites for JCI, NABH, iSquad, lots more info there.